Hello and welcome. You're watching our current affairs program on Fana Media Corporation with me, Zelalem Demse. A country's food system plays a vital and multifaceted role in the development of a country's health sector. And as Ethiopia hosts the second United Nations Food System Summit here in Addis Ababa, we ask how is the country's health sector is benefiting from the transformation of its food system. My guest today is Dr. Mekdes Daba, Minister of Ethiopia's Ministry of Health. Dr. Mekdes Daba, thank you very much for your time.
Thank you very much.
So Ethiopia is hosting the second United Nations Food System Summit here in Addis Ababa. And I think ministries of health, foreign affairs and agriculture are basically responsible, for making sure the summit is successful. And my question will be, how is it relevant and important to Ethiopia, to hosting this internationally significant and much anticipated summit here in Addis Ababa?
Thank you very much. Indeed, this summit is a very great milestone in our country because the first food system summit, which was now followed by the second food system summit, the first one, when it was done back in 2021, our country also aligned with that great alignment plan, and we took the food and nutrition transformation agenda into this. And with the current UN Food System Summit, this makes it very unique for Ethiopia because we're not just talking about food, but we're also talking about nutrition. We're part of a unique country when it comes to implementing both the food and nutrition agenda together, and where Ministry of Agriculture and Ministry of Health co-lead in this bigger transformation agenda along with the other sector ministries. And Ethiopia is also uniquely placed in this scenario because previously we just aligned in our plan with the transformation details being undertaken over the years. And this has been laid by the higher level with the Prime Minister's initiatives, and we aligned this with the national transformation agenda. But the food and nutrition transformation system also has 7 clusters, and among these big clusters there is a bigger loop that you see in the investment that goes to the health sector, which is cluster 2, but we also have other sector ministries that directly work on the food and nutrition agendas in our country. So this is a great opportunity for our country because this will be an opportunity to learn from others of what they did since the first summit, and when we are now all gathered for the second summit in the diplomatic seat of the capital, which is in Addis, where the AU also sits. And this is also a time to really show how you connect the dots from farm to fork, and different sectors play their greater roles. And Ethiopia will be showcasing what are the achievements of the homegrown economic reforms that we have done, including the Lemat Turufat initiative that we have, and the Bounty of Packets initiative, and also the Sakota Declaration and the Sakota Roadmap, which is boldly set in the government's agenda to ensure that we reduce stunting and we end stunting with a limited time period. And this is at a critical juncture of a period where we will be reevaluating where we are, and we will also share our experience from the government's perspective.
People have been wondering, of all the countries in the world, let alone in Africa, why is Ethiopia chosen to host this summit?
Several other reasons could be said about it, because if you look at the vision to really transform Ethiopia with self-sustainability, a lot has been invested. It is not just set in a paper, and several declarations could come, but what you invest on the ground with a long-term investment return are already started to be seen in our country. And another unique thing for Ethiopia, as I told you earlier, is the food and nutrition agenda are brought together. We're not just talking about, if you look even from the acronym, it's a UN Food System Summit. But we added food system and we integrated food systems and nutrition. And where from production to how the country is investing, consciously investing in sustainability, and the agriculture cluster approach that the country has done. And for us, when it comes to the health sector side, from the production safety to the consumption level and the knowledge around the nutrition variety, that how different sectors can come together is very unique. We have 16 sector ministers who would sit on this intersectoral collaboration, and where the Minister of Agriculture and Minister of Health co-lead. And this is one of the, it was very interesting for many when they hear around how different sectors can sit and make nutrition and food agenda all together. And this is not only at a federal level that we're talking about. They also see it as a unique feature where the federal structure also goes to the regional administration, and this is co-chaired and mainly led by at the Deputy Prime Minister level. And every time we will sit and review what has been achieved over the years, what are the challenges, and there is a bold investment in the country. And this has been, we take a lesson from the Sakota Declaration to the Sakota implementation, and it was then integrated with the UN food system, where several other agendas were already set. And we're not just talking about it, but we are also implementing. So I think that made it a bit unique.
We'll talk about the Sakota Declaration in a bit, but I have to ask you this question. The Ministry of Health is one of the stakeholders, you know, yes, in hosting this summit. Would you please take us through, I mean, briefly, how the agenda of food system and healthcare are related? For
health, I mean, the agenda in food system is directly, I'm not going to say indirectly, because it directly relates to health. Before even, I mean, the implications and complications that would arise, if you look at a healthy population, it is a population that is that would have a long-term impact, and the food we eat is going to be our health, type of food varieties that we use, and also, be it the shortage or the excess of what we consume is going to determine what our health is going to be. And in many countries, every nation is starting to see both implication from communicable disease to non-communicable disease. But if you look at non-communicable disease like hypertension, diabetes, and the number of highest cholesterol and cardiovascular diseases that you see, it still directly relates to what you consume and where you invest a lot, be it your time or your resource around. So if you look at also the investment that we do in the early life period, for us the first 1,000 days of a human life are very critical, from pregnancy to the first 2 years in life. That's why when we started the early implementation of Sakota, we started to see the bigger impacts. But of course, the research will tell you there are already plenty of data around why the first 1,000 of life are very critical. Because if there is going to be any reduction in contents of micronutrients that a child gets from pregnancy to the first 1,000 days of life, you would get the implication forever in life. If there is going to be stunting, if there is going to be around how a child would be able to take school. And the school performance is going to be also directly related to the first few days of life, and what the mom who's lactating the baby was eating or is eating is going to be very critical. But also there is also a direct relation to some of the congenital or birth-related complications that you see in early life, folate and other deficiencies that could lead to congenital related or birth related, to put it in non-medical term, is still related to what we eat, and it could have been prevented if we were doing more fortification. And the intersectoral work that we do also has the fortification side to it, where we have the salt we eat. Of course, the consumption has to reduce, but whatever we add into the salt, be it when it is iodized, it is directly related to the health side. And it is about growth, it is about making sure that the early life is also translated into an adulthood and of course even later in or later age. It will also protect the most vulnerable, which is pregnant women, lactating women, and under 2 children. So we're consciously looking at this community with other sectors, and we look at, is it the type of water they consume? Is it the nutrition hygiene that we need to work around? Is it the school feeding program? There is part of the school feeding program, which is Ethiopia's homegrown agenda, and which is now being, you are already starting to see how children who are already fed at school can perform better. And there are several agendas. The bounty of bucket, where many people call it the Lemat Turufat impacts that we've done, and it also targets those community who are in the lower economic, who need more support, and we work with the regional governments, with academic institutions, and also directly with the community, and it directly has all these implications from prevention and also reducing treatment aspect, because treatment is very expensive, and healthcare is going to be much and more expensive if we don't do a lot in prevention side. And investment in nutrition, investment in food is directly related to it.
Thank you very much. So so far we've been talking about the Sakota Declaration, and as you know, Ethiopia has many plans in place, aiming to achieve food security and nutrition to all Ethiopians. And one of those plans is the Sakota Declaration, and we'll talk about it a bit. In terms of the Sakota Declaration and the impact it had in reducing stunting and health issues caused by malnourishment or undernourishment, how is your overall assessment?
There are 3 phases of the implementation of Sakota, and the first phase was the first implementation phase, and then we have the scale-up phase. So during the first 3 years of its implementation, we have already started to see how it can reduce stunting. And per year, 100,000 stunting, child malnutrition and stunting were already recorded. It is a multi-sectoral work, and the only litmus paper that you would have is to measure the growth, and you monitor the growth. And we have done an assessment on what was the impact from the first phase of the implementation. And 100,000 per year is not that simple. 300,000 children were we were able to avert stunting
in 3 years.
In 3 years.
Okay.
And then if you look at even last year, around 1.4 million pregnant and lactating women benefited from this one, and around 3.4 children under 2 were able to benefit from this one, and the impact you will see it later. So it is a matter of where you invest consciously, and it is not just about giving money. It is about enabling the mother, enabling the community, and checking where should be the investment. It could be in school feeding, it could be in supporting that community to work in the farming side. It is multi-sectoral. We have the Minister of Education, Minister of Women and Social Affairs, the energy, water and sanitation. You can imagine all sectors, 16 sector ministers are around. So it already has shown us the real impact. But you would see the bigger impact for the years ahead, because a child averted from stunting, it is about their school performance, it is about their entire mental development, both physical and mental development, and a long-term aversion of both chronic and non-communicable diseases.
From what you've been saying so far, we can safely say that the issue of nutrition is one of the challenges that the health sector is facing currently in Ethiopia. Is that right?
Yeah, of course, nutrition is a very serious issue. And as in any side, because we have several pillars that we work in the health side. Maternal and newborn child health is one of it. And there is a separate unit that is even directly under my ministry, where we look at what is the level of stunting, the level of malnutrition, because malnutrition by itself is big. You have the undernutrition and the overnutrition side. So we take it as a very serious issue, because in a country where communicable diseases plus non-communicable disease burden is increasing, like the level of number of cancer cases, the number of cases with other non-communicable diseases like diabetes, hypertension, you start to see there is a lot that we need to invest, but also on a level of reducing and averting stunting by 2030. It is a very critical agenda.
Mm-hmm. You know, this is also one of the directions of the reform agenda. I mean, the government has, put in place. And there are also opinions, our health system, our country's health system is under lots of pressure. And then there are also people saying that, simply maintaining hygiene and managing the food readily available will ease, the pressure. So what's your view on that?
It definitely does, because as I said earlier, when you look at the food system and nutrition, it starts from the farm to the fork that you eat. So if there is hygiene around it, you can imagine the number of communicable diseases that you could have averted. And an investment in the water side, an investment in the other sectors. That's why we bring all different sectors together. And we look in deep dive into the different waradas. Last year, we had 334 waradas, and we look at where are the critical things that the region and also the waradas want to invest in. Some want to invest around water and sanitation, the water and sanitation and hygiene side, which directly can avert, and we don't do prescription. They can work around what is available and what is the challenge. So the investment you do in any other sector, for us, it's not only about water and sanitation. Look at the investment around light, the investment around electricity. It is about how women would cook and avail a fresh food to their children. And the investment around the irrigation, because the cluster farming, everything is directly related to health, because you could work a lot in prevention than treatment. And the fortification is also another side. As you've said, not only the quality, but also the quantity of production and consumption are very critical. And we need to be very sure that we're not also introducing anything into our food and dietary system that could be a danger to anyone. So we monitor everything from the health side. We have the Food and Nutrition Drug Authority, where we would look at what is available to the community and work with even industry, Ministry of Industry, water, sanitation. Everything is in a package, and wherever we invest, it is directly translated into the health sector side, and you cannot separate them. It could directly alleviate the burden in the health sector side.
And that will translate into our
long
prosperity.
Life. Long life, prosperity, and no investment in, at least in preventable course of days. Sure. It is a days that we're talking about. It is the more you invest in prevention, the more you could have to save for than any treatment, because treatment is always expensive than prevention.
Thank you very much. So that brings us to our last question. So our country is hosting this big summit here in Addis Ababa as the Ministry of Health, and what is your expectation and how do you think will it benefit our country?
We would benefit in several layers. First, we are already bringing many community into the country, and it would help us to learn from others, especially on the food system and nutrition side. We will share our experience, our lived experience, and it also helps in helping others to know Ethiopia and what Ethiopia means. There is going to be both formal, informal relation and communication. Those who came here are going to have. It is part of the medical, the entire tourism that would develop, and it will directly translate into the country's economy. So it has different benefits from technical experts can learn our professionals can learn from the summit. They will have more access into it, and we will also learn from others directly and look when they also go for different sightseeing visits. They can give us different feedback that we can incorporate and use it for changing on areas of projection that we would do in the next years to come. So we would directly benefit from having the summit being here, because it is about our country. People will have an opportunity to know Ethiopia. Some could come for the first time. Definitely it would also open up a door for our tourism. And for the health sector, definitely any investment that comes to the country would have to trickle down, and this is definitely going to be one of it.
We need that.
Yes.
Cheers. Dr. Mekdes Daba, thank you very much for your time.
Thank you very much.
Thank you.
It's a pleasure. Thank you.